Hi, I'm Elizabeth Mack, and I'm the co-founder and CEO of Holistic Caring and the Green Nurse and Bloom Hemp CBD, and I'm here to talk with you today about the 2025 launch of the Cannabis Nurse Health Coach program. We are very excited that the American Nursing Association recognized cannabis nursing as a specialty nursing practice 2 years ago and published the Cannabis Nursing Scope and Standards of Practice together with the American Cannabis Nursing Association. And what we're doing is helping nurses to be able to prepare for that eventual board certified exam. And our programs are going to live up to what you need to understand how cannabis is a specialty for nursing and how you can play your role regardless of what type of a nurse you are. The Health and Human Services has petitioned the DEA to reschedule cannabis as a therapeutic option, and that is underway. But we do hear that President Trump might do something before Christmas this year, 2025. That would be a wonderful gift for the world. And it's not a minute too soon because healthcare is broken. We are moving forward in healthcare, but until we have true community-focused, patient-centered care with preventative mind, body, spirit type of focus, we're still in not getting where we need to with respect to outcomes. And cannabis can help, but it also has issues. Cannabis has been prohibited since the 20s and 30s. 1937, the Marijuana Tax Act taxed it out of existence, and in 1970, the Controlled Substance Act made it illegal. But we've moved past there. 96, California brought medical cannabis back, and fast forward to today, we've got 40 licensed legal states and 24 for adult use, recreational access. But what we're looking for is to get towards Cannabis 3.0, where we have the medical door. And that is where community and healthcare can come together to provide cannabis solutions as part of what we are going to have with respect to healthcare. So how do we build this medical door? It's going to take some time, but nurses are the game changers on how we're going to reorganize, and dispensaries and disease management companies and insurance companies and traditional healthcare getting all the data on how to improve medicine. And yes, patent medications, because we know the pharmaceutical companies are going to want their share of everything. But eventually, nursing and medical schools will be teaching cannabis therapeutics as part of healthcare, as a first-line therapy and not just the last. There are currently about 420,000 jobs in cannabis. There has been growth in cultivation, manufacturing, retail, distribution. And when it comes to medical professionals, states like Pennsylvania, Maryland have been doing really well at inclusion of pharmacists and nurses as clinical care coordinators at dispensaries. And we hope that's going to continue. There will be future nursing opportunities for people to get involved. And think about the one-on-one cannabis health coaching that you can do with patients either on your own or as part of a dispensary or as part of a health system. Community education, educators to the health system, they're all going to need to learn once this is rescheduled. Hospitals, health plans, clinical trials, research, policy development, formulations, product development, lab testing, as well as retail sales, distribution, marketing, and community outreach. All of that is going to be coming in the future. And you can find your path, but expertise is going to be needed from pediatrics to geriatrics. And by the way, there are 10% or more of older adults using cannabis as a therapeutic option for pain, sleep, anxiety, stress. They're taking CBD, they're using THC, they're experimenting with gummies, and they all need some hand-holding in order to be safe, because cannabis is not always safe for all people. And we teach you in this program how to be helpful for all populations and demographics in making it something that they can adopt, optimize, and retain as a therapeutic option. So the Cannabis Nurse Health Coach program can help open that medical door in America. It is a comprehensive 30 CEU unit curriculum for nurses and other clinicians. All licenses are welcome, although the CEUs right now are only for nurses. There is an optional monthly mastermind and nurse mentoring where if you opt for the mastermind, you also get a toolkit, what I call the business in a box, so that you can build your own practice. And then in our masterminds, we go through case studies and clinical conversations. And then, of course, there are clinical conversations that Nurse Sherry and I perform every single month, just about, where we're breaking down a clinical condition where conventional care treats it and the shortcomings and limitations of that, and then how cannabis might be applicable along with the research, the protocols, and case studies on how to maximize the benefits and minimize the harms of using cannabis. And then there's our networking and all kinds of things that are happening within the network. So let's just jump in and take a quick tour of the program. This page is going to open up at holisticcaring.com, and you can see the CNHC program and the mastermind and toolkit have been separated. For a while, I only sold them together, but for affordability and for people that are working in a hospital that don't want to build their own practice right now, it is nice to be able to just have the program. And so that's what we've done. And of course, you can buy them together. So anyway, there are lots of things that you can read on this page about the ANA press release, the NCSBN guidelines, which will take you over to there. And then it talks about the program as well as the future of board certification and the different therapeutic options. You can see this is my largest one. And then the clinical training. So 3 modules, 30 units, narrated presentations, case studies, protocols, 200 practice questions and quizzes, including in the final exam, all the APA references and direct research links so that you can endlessly explore your curiosity at this. And then everything is yours for a 1-year period. And by the way, there are assignments, extension activities to put this in the real world. So if you click here, you can join our network, and then it'll take you right into the program. Once you're enrolled, of course, I have direct access because this is bookmarked for me. But we start out here, the origin story, that's where you begin. Then think about progressing into the overview, and you can see all the learning objectives. There's a pre-test to test your knowledge coming into the program. And then, of course, the final exam is at the end. And Module 1 is all of the fundamentals of the history, the research, the science about cannabis, the cannabinoids, terpenes, how to make medicines, how to grow medicine, cultivation to extraction, and then all of the products that are out in dispensaries today, the pharmacology, like what the body does to the drug and the pharmacokinetics, and then the pharmacodynamics, what the cannabinoids do to the body and how this works to activate receptors to help us heal. Then we go into dosing and titration, and then the medicalized approach, where we talk about safety considerations, interactions, and those kinds of conversations that you can have with patients. And then the fine print is all of the different risks and things that we need to steer clear of with respect to demographics and safety precautions for pediatrics and geriatrics, as well as the developing brain, pregnancy, and of course, greening out when people have too much THC. Module 2 is where we introduce the therapeutic potentials in an overview setting, the stage, and then go into demographics, women's health, men's health. And then we move into the deep dives on the conditions, where we have what the condition is and somewhat of the pathophysiology of that. And then we talk about the cannabis research and how cannabinoids might be applicable to modulating that condition and helping people to heal and at least improve quality of life. And then all of the units have a protocol slide as well as a case study slide where we talk about some of our patients that have gone through cannabis as a therapeutic option and what their outcomes were, and as well as the protocols that they use so that you can learn from our doing. And then, so we have neurological and neurodegenerative, psychiatry, chronic pain, autoimmune, metabolic, cancer and oncology. And then module 3 is where we host the business aspects of cannabis as a medicine, where we talk all about the legalities, medication or supplement, what is this? Safe shopping, cost of care, provider legalities and practice settings, scope and standards of care for providers, as well as nursing, where we truly bring this book to life and go through the 18 different standards of nursing. As then we jump into advocacy and business opportunities, the business aspects for cannabis health coaches, where we teach you how to set up your own practice and to interface with the community and other people in this industry. The licensing and regulatory environment for anybody that wants to pursue licenses and work in the industry, with respect to owning businesses or partners, etc., and then networking, etc. So then we have a final exam where you have 30 questions and you need 80% to pass, and it's not too difficult. But if you study everything in the program, you will be able to pass no problem. And then you hit the program evaluation where you let us know what you thought of the program, and then you get your CE certificate sent directly to your email. There are some continuing learning library and resources, but to jump into the CNHC Mastermind and Toolkit, you can come over to this thing, this little button here, and you can get into the Mastermind and Toolkit section. We have the feed where we're posting different things. This is for our meeting that we just had last week. And then the CNHC Toolkit is where you're going to find all of the quick start guide to starting a business, the community flyers, the community presentation, where you can just pull this down into PowerPoint, modify the slides however you'd like, but the 101 is all done for you. And then here's the script that you can memorize and present, a 90-minute process of how to do an appointment, and all of the different things that you need to hit as you are walking a patient through the assessment and the patient teaching and how to track and how to implement their cannabis protocols. There is a wonderful glossary, and the disclosure and liability waiver forms are all done for you. The types of things you need patients to sign off on, that you're coaching them, and that this is educational in nature and not a provider-patient relationship, which is still very important as this is a Schedule I drug. Then we have intake assessments, so for adults and older adults, and then pediatrics. So then we have some different questionnaires. If people say that they're not sleeping well, they're in pain, or that they've tried CBD and it doesn't work, well, we know that it does work. It's just a matter of what they were using and how much, because quality matters as well as dosing. And that's why you are here, to make a difference in these people's lives. So dosing overview recommendations and how to stage that. Patient teaching template, all done for you. There's a primer ebook that you can have, the Medical Cannabis Guide. This is a 7-page guide that you can also teach from. Cannabis tracking logs in Excel and a PDF. And then formulary dosing guidance from dispensary products. So this is everything that you would find in a modern dispensary, and how to help people to be able to utilize that. Then we have our care plans. So there's a fillable care plan that you can download and work with. And then we give you some examples of pediatrics, geriatrics, and we are going to be adding more. So that is the toolkit, and there is so much that you can learn between that and the 2025 Cannabis Nurse Health Coach program. And a quick note of other interest in the network: there is a home space where I invite you to come every day because I'm always posting things as far as current events and news for both healthcare and cannabinoids. This one is about rescheduling. Then we talk about business licensing in cannabis, as well as new clinical studies that are out. And again, I'm putting things there all the time. And then we have our events tab, where we invite you to come to our casual conversations, our plant medicine support group, our masterminds, and then the clinical conversations that we perform almost every month. These are all in the library, so I invite you to go and watch the clinical conversations where we break down other topics that you're going to want to learn, talking about aging and how to make cannabis work for you, regardless of what the condition is, from cancer to chronic pain to neurological and neurodegenerative conditions. So it's all right here in the network, and we invite you to join and hope to see you on the other side as a client and a customer with us. We will take great care of you, and we wish you all the best in your pursuit of cannabis therapeutics. Thank you, and God bless.